When we talk about diseases that affect the brain, one of the most common symptoms is headaches. Every condition that you go through in your daily life can cause headaches. Not enough sleep, dehydration, stress from traffic, stress at work, stress at home, all result in headaches. Even as a doctor, I have headaches when I'm trying to get to work. You don't have a good night's sleep, or you don't eat on time, not enough fluids in your body, all result in headaches. So the question is not so much of headaches, but when exactly do you need to be concerned and see a doctor? If your headaches are persistent, you wake up with headaches, severe pounding headaches. Now that's not something to ignore. That is a sign that something else is happening than just a mere regular headache. Some patients have migraines. They've probably been having migraines for the past 10, 20 years of their life. It comes and goes. There are very clear triggering factors for the migraine. They know how to treat their own migraine, or they know how to control their migraine. But when your so-called migraine has changed character, the pain is no longer similar to the previous migraine, you have more frequent onsets of migraine in your daily life as compared to perhaps 10 years earlier. That is when you need to be concerned. Come to the hospital, see a specialist, and get a check done. Check yourself up, get an MRI, get a CT scan, and make sure it's just a migraine, not something more. Common symptoms of headache that requires a person to be a bit more vigilant or to be a bit more careful is when your headaches typically occur when you have this pounding headache, feel very nauseated, vomit, and the vomiting relieves your headache, and that is a sign that should not be ignored, and I would think that you need to come to the hospital quickly to get yourself checked. If your headaches are associated with vision blurring, some patients visit various optometrists because they feel their headaches are caused by their eyes. They keep changing their glasses, but it doesn't seem to go away. So some headaches which results from brain tumors or brain pathology can affect your vision. After you get your eyes checked, do come and see a doctor to make sure there's nothing else giving you a problem. Some patients have headaches with numbness in their face or body that comes and goes. This again is not a sign or symptom that should be ignored. You should come and see a doctor. Headaches are classified into benign and malignant. Benign headaches are related to stress, inadequate sleep, work, traffic. When headaches come with the feeling of nausea or vomiting, it doesn't seem to go away. It gets worse every day. You have associated vision problems, numbness in your limbs, either in your arm or your leg. You have giddiness, severe vertigo with your headaches. You develop seizures. Then these symptoms and signs which should never be ignored. You should come to the hospital as soon as possible. Get yourself checked because you may have underlying vessel problems, an aneurysm, brain tumor, or other pathology, or small stroke, for example, that may have caused you all the symptoms.